Thanks and welcome everyone to today's Policy Power Lunch, assessing the impact of the Medicaid unwinding. My name is Kyle Shavasta, Project Coordinator on the Policy Impact Project, and with me today are my colleagues, the co-directors of the Policy Impact Project, Caitlin Coffer-Miller and Anne Rue. So at the Policy Impact Project, we want to change how the system works. Right now, there's a big gap between research and policy, and we want to make sure research and data are understandable so policymakers can use research to influence positive policy change. Policy changes that focus on making the lives, service access, and health outcomes of autistic people better. In that vein, today we are joined by Joan Alker, Executive Director of the Center for Children and Families and a research professor at the Georgetown McCourt School of Public Policy. Today, Joan will be talking about the Medicaid landscape and what it looks like as the U.S. moves from the Medicaid continuous coverage requirements and transitions back to regular operations after the public health emergency has come to a close. Now, before I hand it over, I just want to go over a few house rules. To ask a question to the panelist, please write your questions in the Q&A box below. You can ask questions throughout, and if appropriate, we will be answering ongoing, but there will be a facilitated time dedicated at the end of the presentation. Remember, questions in the Q&A, please. If you are experiencing technical difficulties, please write your comment in the regular chat box below, and someone will respond to you directly. If you are interested in closed captioning, also there is a CC icon, and we have enabled that for you all. And with the speaker's consent, we are recording today's presentation, and it will be updated on our website, and we will send out that link afterwards. So, Joan, thank you for joining us. And without further ado, I would like to hand it over to you.
Well, thank you so much, Kyle, and for inviting me to join you today to talk about a really, really important thing that's going on. That's pretty, I'd say, one of the most important events to ever hit the Medicaid program. So with that, we can go to the next slide. I'm assuming you're all here because you understand very well the importance of Medicaid to our healthcare system. And during the COVID-19 public health emergency, there was a provision enacted in one of the earliest COVID relief packages that essentially made everybody eligible for the duration of the public health emergency. In other words, nobody could be involuntarily, disenrolled. So certainly if you raised your hand and said, I don't want Medicaid anymore, a state could end your coverage, but otherwise states could not end coverage for folks. And this was a really big deal because normally we see quite a lot of churn on and off Medicaid, both for people who are eligible and people who aren't eligible. So as you can see here, this is looking as of last August, the increases in Medicaid and CHIP enrollment reflecting the impact of this continuous coverage provision, which, by the way, I will just say was signed by President Trump. It was really an initiative of Speaker Pelosi, and President Trump signed the bill. So Medicaid already a critical source of coverage for families, for people with disabilities, for low-income seniors and folks needing long-term care, and for communities of color, it became even more important. And at the beginning of the pandemic, covered 54% of all children in the US and about a quarter of the population overall. So we can go to the next slide. So because at the Center for Children and Families, we're focused on children and families, which we define very broadly, our concept of family. But we do a lot of work in the space of children, and I will talk a little bit about some of the data that we looked at. So as I just mentioned at the beginning of this disenrollment process that we're currently in, we had 54% of all children in the country who were being insured by Medicaid. And that was a larger percentage for children of color. Unfortunately, we can't break out those data this way, but we know from other data that was disproportionately true for children of color. And in certain states, and here you can see we had 11 states that had over 60% of all children enrolled in Medicaid or CHIP during the pandemic, right up to the New Mexico and the District of Columbia where I live, where we're talking 3/4 of all children. So this is a major, major event for children, for families, and for pediatric providers. And more broadly, of course, for adults who are enrolled in Medicaid, either because of income or because of their disability status. So we can go to the next slide. So fast forward just for a little bit of level setting as to what happened. So initially, Congress had tied the end of this continuous coverage provision to the end of the public health emergency, which happened, I believe, in May, that President Biden lifted it. But Congress actually stepped in the Consolidated Appropriations Act, which was the big budget bill that passed at the end of last year, and delinked the ending of the protection from the declaration or the end of the declaration of the public health emergency. And so, so it actually ended a little more quickly for Medicaid than was originally conceptualized. So the protections in place ended March 31st, 2023. States could begin terminations April 1st, but states also had a lot of choice about when to start. We'll come back to this issue. And overall had 14 months to complete this process, which is essentially checking eligibility for everybody who is being covered by Medicaid. And you'll remember from that earlier slide, that's 90 million people. So that's a really, really big task. Now, really important to remember that when Congress enacted this continuous coverage provision, they gave states extra money to cover the additional costs, an extra 6.2% in what's called the FMAP, the Federal Medical Assistance Percentage. Every state saw a bump up in their FMAP of 6.2% for Medicaid. And in something that's rarely talked about, they also got a bump up of 4.34% in their CHIP match rate, which runs off the Medicaid match rate. So despite what is often a false narrative, states have not, and we're not losing money on this proposition where they had to keep folks on Medicaid. They actually, according to analysis by KFF, most of them were making money. And what they did with that money is another question. Tax cuts, rainy day fund, you know, no one has done a comprehensive put out there that this really was injurious to states' budgets. So, so what Congress did is, in allowing states to start, excuse me, April 1st to terminate folks, the way the law had been structured was that this extra money was going to go away quite precipitously under the prior law. It was all going to go away in the quarter where the PHE lifted. But Congress added a sort of smoothing out of that path. And so the money itself, the extra federal money, is being kind of tailored down over the course of calendar 2023. There's a gradual reduction in the match rate. And you can see here in the first quarter, it stayed the same as it had been. But in the second quarter, the Medicaid match went down from 6.2 to 5.0%. That's that solid gold line. And the CHIP match went from 4.34 to 3.5%. And then in the final two quarters, where we are now, we're just started the last quarter, the extra match is 1.5% for Medicaid. So these extra funds will go away at the end of this calendar year. And certainly for states that are aggressively moving to kick people off, this is probably one of the reasons why. It's not the only reason why. But it was good that Congress stepped in and had this more gradual glide path, essentially. So states have to conduct a full renewal for pretty much everybody enrolled in Medicaid. And Congress required that states had to meet certain requirements to continue receiving this additional federal funding and to avoid financial penalties. There's quite a lot of enforcement tools that Congress gave the Centers for Medicare and Medicaid Services, the federal agency that runs Medicaid, to enforce federal regulations. We can go to the next slide. So how many, we've talked about this is like a really major event to hit the Medicaid program. And I'm sure all of you can think of many reasons why this is so challenging. There's a lot of people. States, many of them are short-staffed, facing labor shortages like other employers, but also in many states are just not, public services not particularly valued, and there's underinvestment in the public sector. And it's a really complicated process because Medicaid eligibility in law is super complicated. And then we have the politics of some folks just want to really bring down their Medicaid enrollment, certain political leaders. And then, of course, a lot of these folks have not had a renewal in 3 years. And that's, their address is very likely to have changed. Low-income people especially have high rates of residential mobility. A lot of things happened during the pandemic period. There's been a lot of moving around. So everybody anticipated hard to find people. So this is a challenging process for sure. So prior to the unwinding beginning, ASPE, which is part of federal HHS, the Assistant Secretary for Planning and Evaluation, put out a report in August 2022 and projected that about 15 million people would lose Medicaid. And some of those would lose while they were not eligible anymore, and some of them would lose despite being eligible. And particularly ASPE identified, and we also in our own report had highlighted this issue, that children are most at risk of this churning. And that's really because children are eligible at higher levels than adults. And we'll come back to that point. Also, people of color are most likely to lose coverage inappropriately. And we estimated that as many as 6.7 million children could see a gap in coverage based on historical churn rates. And the key question, of course, is, we have millions of people losing Medicaid. We do, 7 million at least have already lost. Are they finding a new coverage source, right? And that's a critical question. Some of them undoubtedly are, some of them are not. And we can come back to that question. So next slide. So again, right, transitions to other coverage is a key question. And here you see a report from the Urban Institute that was looking at adults in particular. And again, the issues are different for adults versus children because the structure of coverage is different for adults versus children. But employer-sponsored insurance, ESI, was the #1 place that the Urban Institute and other researchers projected that adults would go. And again, this is a different question for children because, as we all know, finding an offer of affordable dependent coverage for low-wage workers is really tough. It's tough for the low-wage workers themselves, but for their kids, very, very tough. So ESI will not be a place for as many kids. Other public coverage that could include Medicare. And then, of course, the marketplace is another place that folks could go, particularly adults. Some will become uninsured. Some might go into sketchy plans, shall we call them. So the Biden administration, which runs the marketplace, has spent a lot of time preparing for this and thinking about smooth transitions to the marketplace. They fixed the family glitch. They have created a special enrollment period, and this is an important point. So as you know, the marketplace does have open enrollment. Medicaid is open year round, but the marketplace open enrollment is starting very soon. But if somebody's lost their Medicaid, they can come into the marketplace anytime. They don't have to worry about open enrollment periods. That's a special rule in place now. And the other thing that I think is very little known is that federal law requires that for those who lose Medicaid, ESI is open to them for 60 days. Period, end of story. That's not well known. But anyway, there's lots of challenges in terms of folks moving to other coverage sources. Children should really be moving to CHIP. Unfortunately, many of them are not, for those who are over income eligible. And so far, we've seen about 10% of folks moving to the marketplace, which is a little bit lower than was expected. So, all right, let's move to the next slide. So why do I keep saying that this is a different equation for children and adults? And I'll say that sort of for us at the Center for Children and Families, a lot of times we don't want to think about children in isolation of their families and caregivers and communities. That's just the wrong way to think about it. But in this particular case of the unwinding, there's really a reason to think about children and adults differently and to underscore that there are different structures of coverage. And primarily, what I mean when I say this is that children's public coverage eligibility is much higher than adults. Here you see in states that have expanded Medicaid, like Pennsylvania, like 40, boy, I think we've got 10 states left that haven't expanded Medicaid now. Children with Medicaid and CHIP, the median eligibility is 266% of the poverty level. For adults, it's 138%. Now, over that, they would go into the marketplace in most places. For non-expansion states like Florida, Georgia, Texas, being three of the big ones, it's a much bigger disparity between the children and the parents. So we were worried about this all along, that children's coverage was going to differ from their parents, and that was going to be a problem. And I think it has. Excuse me. And it's also worth noting that in these non-expansion states, most of the unwinding folks are affected by are going to be children, very poor parents, and people who are very new parents who are coming off pregnancy coverage in Medicaid. So I think we'll go to the next slide. Okay, so that's sort of the setup of what we were expecting. You know, we were very worried that lots of folks would lose coverage. And unfortunately, we continue to be very worried that lots of folks are losing coverage, experiencing gaps in coverage as this has begun. So we can go to the next slide. So, excuse me, I mentioned earlier that states really have a lot of choices here. And the first date that states could start was April 1st. And we saw 5 states that got started right away. Arkansas is a notable state in this regard. The legislature actually passed a law there saying you got to get this unwinding done in 6 months. So they got right out of the box and have been extremely aggressive and have now kicked off more people than enrollment went up by during the pandemic, which wasn't a good marker to get back to anyway. But the states that started out early were Arizona, Arkansas, Idaho, New Hampshire, and I think West Virginia, but I may be wrong on that 5th one. And you can see that most states got started by June. We've got one state, Oregon, which just got started because they've really reconceptualized their entire eligibility system in a really exciting way. They got a Section 1115 waiver, and they're offering continuous coverage for infants to age 6 and then 2 years after that. So we can talk about that in the Q&A if folks are interested. But the point being that they really use this pandemic to rethink what hasn't been a great system with a lot of red tape, and that's very exciting. So that's sort of the good news part of the equation. Now, it's hard keeping track of which states are starting and stopping because there have been various reasons why both the federal government has made states press a 30-day pause, or states have voluntarily pressed a 30-day pause. So the timelines have gotten a little bit screwy, but this gives you a general sense. And at this point, all states are off and running, although some states like Hawaii, for example, has paused all their procedural terminations till the end of the year because things are going so badly. So I'll explain that more in a minute, but we can go to the next slide. Okay, so just kind of an overview of themes, what we've seen so far. You know, on the plus side, we heard a lot from states, particularly those that wanted to kick folks off pretty quickly, that they had these long lists of people that they said were ineligible, that they'd been checking their income during the pandemic, it had gone up, or they'd aged out and they were no longer eligible. And however, states are required to check to see if somebody's eligible under any other category, recheck these assumptions they've made before they could cut them off. That's a federal regulation. And many folks, when they checked them, and Arizona really has the best data on this, turned out to be eligible. So this wasn't super surprising to us. But nonetheless, that's good news that there are quite a number of folks in states that are doing this process relatively well who are retaining coverage. Now, CMS, the federal agency, did really think creatively and offer states a lot of flexibilities, ways to do automatic renewals more smoothly, ways to link up with other programs, ways to involve managed care companies in the process to help. And many states have taken up those flexibilities, not all. Now, the data, we're going to spend a lot of time on this, so I won't talk about this too much here, but quite a number of states are posting data pretty quickly on what's going on, which is good news because the federal data has not been so quick to come out. And states are really, some of them are really looking at ways to improve their system. Like I mentioned, Oregon being the most notable and really reconceptualizing their whole system. But, you know, a lot of problems that we're seeing now existed for many, many years. And ultimately, this will spur change in a good direction to get rid of red tape and complexity in the Medicaid renewal process. Although, unfortunately, we are going to absolutely see lots of folks losing coverage for a time period. So that brings me to concerns. Well, we have a lot of concerns in terms of why folks are losing coverage when they shouldn't be. One of the areas that's been really clearly a problem, and again, this wasn't a new problem, but now, of course, we've got 90 million people going through this process, and this is a massive undertaking. But the notices that people are getting, this is a complex topic. The notices in many places are really confusing. They don't clearly tell people what their rights are. They don't clearly tell them, oh, you know, you can go here to try to find coverage for your child. That might be different from yourself if you're a parent. The child might be going to CHIP. You might be going to the marketplace. You know, there's just, the notices are in a lot of places a hot mess. I mean, I have read quite a few of them and I have a lot of trouble understanding them. So that's a big problem and something that is good to look at in your state if you're following up on this, to check those notices. We've heard of lots of mail delays, problems with the call centers where people call to get help, long wait times, just difficulties for people whose first language is not English. And we've had a big problem with respect to ex parte renewals, which I'm going to come back to in a minute. And we've seen very high level of what we call procedural disenrollments. Now, these are disenrollments when somebody doesn't complete the process. So it's not because they've been determined ineligible. It's because they haven't got through the process. And sometimes you'll hear this described as, oh, well, they didn't open their mail. They didn't return the form. It's a lot more complicated than that. There are many, many reasons why folks are not getting through the process. And this has been, I think, really pretty shocking, the high levels of procedural terminations that we've seen. Key point. Also, when folks do receive notice that they have lost their Medicaid, there is a 90-day reconsideration period where they don't have to file a whole new application. but they can just ask to have their case looked at again and provide some additional information so that they can get back on. Again, we are remain worried that parents are confused about child eligibility, but as it turns out, so the state seemed to be confused about that in some instances as well, or at least their systems are programmed wrong to reflect the differences in child and adult eligibility. And then in terms of corrective action, sometimes we're seeing kind of a slow response. So we'll come back to that. So we can go to the next slide. Okay, I think I'm gonna skip over this one. This is, for folks who really want to go deep, is just gives you links to a lot of the guidance that CMS has put out. We're going to walk through a couple of big issues that have come up. But again, this is, I think, more of a resource for you to have if you really want to do a deep dive into what CMS is doing. And I can talk about that more in the Q&A if folks are interested. But let's move to the next slide. So CMS, one of the things they are required, and previously we're collecting some of this data, but the Consolidated Appropriations Act that we talked about required them to collect more data and share it publicly. And so these are the kinds of data that we saw from initial months that they've released, May in particular, of call center wait times. Now, these honestly look a lot better than what we hear about from folks in the field. And so how they're being reported is a key question, right? Is it call center wait time until the call gets answered by some kind of voicemail triaging system? And maybe that happens very quickly, but then it takes you a long, long time to get to somebody who can actually help you. But that's being counted as actually the call being answered. So CMS did send letters to every state on August 9th and flagged if they had a relatively high rate of wait times or call abandonment rates when folks are just giving up and hanging up. And they identified 16 states where these numbers, these metrics looked high, and sent kind of a warning letter on August 9th to all states and indicated how they looked on those metrics. We can go to the next slide. So, all right, let's talk about procedural disenrollments. This is, again, sort of the big kind of buzzword in Medicaid now. It's really a big problem. You can also think of them as red tape losses. That's how we think about them. And what are they? So just sort of quickly to run through the process, what states are required to do is when they're renewing somebody, they must use available data they have on hand to look at and determine if they can just already tell that somebody's eligible for Medicaid, right? So they've got a lot of data on hand. They know how old folks are. They know in some cases have quite a bit of data about their income, which is a key question. If they have wage data, unemployment data, SNAP data. So states are required to use their available data to just renew folks automatically if they can without seeking any further information from the family. And that's called the ex parte process that we'll come back to in a minute. But after the ex parte process, let's say that, and states have very different rates of ex parte renewals. If that doesn't happen, if someone doesn't make it through the ex parte process, states are then required to send a pre-populated form, and it shares the information that they do have, identifies what they still need, and they send the pre-populated form to the person, and the person has to return that and try to retain coverage that way. Now, also states are required to have multiple modalities for folks to do that through the mail, online, on the phone, or in person. That doesn't always happen functionally either, but that's the rules. So So historically, many people who lose coverage for procedural reasons, they remain eligible, particularly children, but they become uninsured because they just haven't made it through the process. And here you can see on the right, some of the reasons why this might happen. They didn't get their mail. Okay, the state had the wrong address. There was a mail delay, and you only have a certain number of days, which varies by state, to get your information back in. And if you had a big mail delay, it took a long time to get the notice, and they missed the deadline for returning what they needed to return. The notice was confusing. We talked about that. Notice not in the enrollee's preferred language. They weren't able to get through to the call center. The state lost the paperwork submitted by the individual. We hear a lot about uploading not working on state websites. People upload their documentation, but it's not reflected as having been submitted. Or the individual is unable to obtain paper documents documenting their income, for example, that they needed to prove eligibility. So many, many reasons why the process goes awry. You can go to the next slide. So this, coming back to the ASPE report I mentioned earlier, if you look at the red bars on this, children and young adults are at greatest risk of procedural disenrollments. In other words, losing coverage while they remain eligible. This is what researchers projected, and it's pretty striking when you look at that first number there, 0 to 17, that 74% of kids that are losing coverage are likely to remain eligible. So this is a huge problem. Most of these kids are still eligible and they really shouldn't be losing, but unfortunately we're seeing substantial losses for children. Next slide. So I mentioned earlier that people of color are also at higher risk, and we know this from prior data that they have greater risks of churn or procedural terminations, not able to get through the process. And that's probably not super surprising given some of the issues that I talked about in that earlier slide. Issues with language access, big issue, particularly for Latino families, but really all groups of color have higher rates than the norm of losing despite being eligible. We'll go to the next slide. So fast forward, as we talked about a lot, we're super worried about this problem of children being eligible at higher levels than their parents and not getting screwed up. Come to find out that in many states, it was getting screwed up. Exactly why, we're not sure, but basically in the ex parte process that I described, which is what states must do first, that they have to go through and use their available data, state IT systems were programmed to make that assessment based on a household determination, not an individual determination. So in other words, if the state went through the ex parte process, and this is not a problem exclusively affecting children, it could affect adults too. If you have, let's say, two adults who are in the household together, and they one of them has a disability and one of them doesn't, and they fail the ex parte process as a household because the one who doesn't, their income has gone over income, the whole household would fail, even though the person with disability should have stayed on. And similarly with children, if they checked against the parent's eligibility, it's undoubtedly lower, unquestionably lower than the child's, failed the whole household. Instead of what they should have done was keep on the children or the person with a disability that they knew was still eligible. They failed the whole family in the ex parte process, the whole household. And then when, of course, as we just talked about, you go to the pre-populated form and end up with a lot of procedural terminations, as we've discussed. So this kind of came to light in August. The Biden administration announced that they had discovered this glitch and that many people, largely children, had been wrongly removed. At the time, they estimated about 500,000 people, but I think that was extremely rough. And of course, that was just people who'd already been wrongly removed, not, of course, what would have happened going forward as more states ramped up. if this error wasn't fixed in the computer systems. So we can go to the next slide. So again, this is sort of runs through what I talked about here, what the problem was. So we can skip that, go to the next slide. And we go to the next slide. Thank you. We were happy to see, I'm going to switch now and talk about the data, but just to say, we were glad to see that the Biden administration took a strong stance on this ex parte problem. They asked states to respond within a couple of weeks as to whether they had the problem. States have to fix the problem. They have to reinstate people who were wrongly terminated. All of that is going on as we speak. And there were about 30 states that raised their hand and said they had the problem. Okay, so there's a lot of data on this, and I think in the interest of time, I'm gonna kind of whiz through this, but I want to make sure that you all know where you can go to look for more data. Now, I talked about this earlier. States are required to report certain metrics, and CMS has to report them to the public. But that's been a little bit slow on the federal side, and states have developed their own data dashboards in many cases. This varies quite a bit by state, but we do on our own website, we have a 50-state tracker, and you can go in there and see if a particular state has a data dashboard. Let's go to the next slide. So there's lots of different kinds of data, and this is where you really have to be kind of into the weeds here. Of course, there's a lot of data about how many people are retaining coverage, how many people have been disenrolled, how many have been enrolled on the ex parte, renewed, excuse me, on the ex parte basis. We talked about that. How many have been returned via the form? We talked about the pre-populated form. That has to be reported to the federal government and on a standardized form. Unfortunately, it does not have to be disaggregated by date, by age, by race and ethnicity, or by eligibility category, which would help us look at, for example, folks who are on SSI who are losing coverage. Some states are reporting that on their own data dashboards, but it's not required by the feds. But then there's other kinds of data, which is really looking at the process, right? And see what's going on with the process. Are applications being processed in a timely manner? Has that slowed down, right? With this big logjam that's happening, you know, we've got folks who are losing coverage, and then they're coming back in the reconsideration period, or they're discovering, they go to the doctor, they go to the pharmacy, they find out, oh boy, I'm not covered, or my child's not covered. And so they reapply. So, right, so the system is really getting backed up here. So those kinds of application processing questions, also metrics like how many fair hearings are required to be reported. So go to the next slide. So CMS is releasing monthly unwinding report data at the end of every month. It's been a little bit slow, quite honestly. The first data came from April in the end of July, so it was kind of a 3 to 4 month lag. And we and others have been pushing them to speed that up. And you can, generally speaking, actually find more updated data on our website, our Georgetown CCF website, because we're just taking it directly from the states that are posting it and aggregating it. And also Kaiser Family Foundation, KFF, is doing the same thing. So we don't have, of course, all states, because not all states are publicly reporting it, but we have a lot. So that's actually the quicker way to get to a lot of this data. And we'll look at that in a minute. But there's certain things that, like call center statistics, that not a lot of states are posting those. So you really have to wait for the CMS data. But CMS is also posting transfers to the marketplace They just posted some more data about that. So important place to look, and that's what it looks like on the CMS website. Next slide. So this, I think we talked about a lot of this. So I'm going to skip this, the kinds of data that you can see in that CMS data. Great. Okay, so this should be useful. This is showing you state Medicaid unwinding dashboards, where states have a dashboard, where they don't, where the data is coming in from CMS unwinding reports. In some states, they're just posting that, like Texas. Well, actually, Texas is doing two things now, but they're reporting, they are putting up what they sent to CMS, and quite a few states do that. And then some states have their own additional metrics that they're doing, like I said, that are more detailed than what they're required to report to CMS, including disaggregating by age, sometimes by race and ethnicity. That's not very common. By county sometimes, and by eligibility group. So again, you can find all of these in our 50-state tracker. And we'll go to the next slide. Okay, so this is one of the things you can find on our website. And if you go to our website and you look at topics, there's an Unwinding the PHE tab, and that's where all this data is. We have a lot of data. So what we're doing here is we're looking at how are states doing so far relative to other states, and what's happening with renewal outcomes. So on the left, and I'm sorry, because this is very small, it's probably really hard to see. You can see Oregon, and then it says 1 there. That's the number of months of data we have. As I mentioned, Oregon is a late starter. Down at the bottom, Iowa, we have 5 months. So what we're doing is aggregating what's happening. How many ex parte renewals have happened? That's the dark blue. And basically seeing a lot of dark blue is good because, as I mentioned, the best way is for states to do automatic renewals, so the person doesn't have to do anything with the data they already have on hand. And a lot of dark red is problematic because that's procedural disenrollments. So on the right, we broke this out by just looking at the people who have lost their Medicaid coverage, disenrolled. The blue is where they've actually been determined to be ineligible, whereas the red is just a process failure. So you can see here in this example that Mississippi, not alone, lots of states have high rates of procedural terminations, but at least as of this chart, Mississippi had the highest and Minnesota had the lowest. Now that could be because Minnesota's pausing procedural disenrollments. It probably is, but in any event, you get a real sense here of how states are doing and how committed they are to minimize these procedural disenrollments. Next slide. So this is a terrible picture here, but just to say, Kaiser Family Foundation has a lot of information at kff.org. When I checked the other day, they're up to about 8.7 million people have been disenrolled from Medicaid. If we go to the next slide. We have our own tracker that looks specifically at net child and total Medicaid losses. So that's a different number from disenrollment, right? Disenrollment is just how many have been disenrolled based on all those reports states have to do. But net, of course, is we've got some people coming back on, and then we've got more people being disenrolled. So net is just net. Net is where do we stand? And at least for children, we're now at about 1.8 million net child Medicaid loss. We expect to hit 2 million next week in our tracker for children. And just to give a sense of how massive this is, during the Trump administration, for a variety of reasons, Medicaid enrollment went down. And again, we were worried. They said it was fine, but we didn't think it was. It went down by about 1 million children, a little under 1 million children. And we saw a 1 percentage point increase in the uninsured rate for kids. It was the first time the uninsured rate had gone in the wrong direction in many, many years. So we're already at 2 million and counting. And so next year, when we see the uninsured data, we'll know, but we're extremely worried. Next slide. Here's just a map that we put together looking at where are children losing Medicaid. This is also on our website, but as you can see, Texas is really leading the pack. Texas has unfortunately distinguished itself by huge numbers. Just there are over 1.2 million people have been terminated from Texas, and we can't quite do the latest percentage, but we believe over 80% of those are children, and most of them remain eligible. So this is just a massive disaster for children and families in Texas. Florida's got quite a few as well, but Texas really stands out. Arkansas as well has really moved quickly and aggressively, and so anyway, this gives you a sense of that. We can go to the next slide. So this is kind of the cumulative outcomes. You could use this if you want to compare to your state or a state when you go to look at our data. So you'll have this on hand. Next slide. So again, this just kind of looks at the three main sources of data where I think you can find more data: federal CMS, our data at Georgetown Center for Children and Families, and KFF, or Kaiser Family Foundation. And we'll go to the next slide. Okay, so I want to leave some time for questions. So I just have a few slides here that I'll go through pretty quickly. You know, this is not good, as you can see from this presentation, what can be done. And I'm just going to highlight here, if we want to go to the next slide, a couple of things, both on a sort of systemic level and an individual level. So looking at, I think the next slide is going to talk about feedback loops. Yeah, here we go. So we've been saying for a while that feedback loops are really important. So at the state level, really encouraging states, and some of them are doing this, some of them are really not doing this, to learn, you know, talk to folks who have Medicaid and folks who work with them, community health clinics, legal service providers, pediatricians, you know, schools, churches. Find families where they're at, find people where they're at, and learn about what's going on. What are they experiencing? What went wrong in the process for them? And have a kind of very active feedback loop with key stakeholders in the field so that you can identify these kinds of problems quickly and try to fix them. And we've had a lot of media attention on this, which is helpful to really create awareness and pressure so that policymakers take quick action. And then on the national level, you know, many of us are trying to get quick feedback to CMS with specific examples of what's going wrong. Okay, so we can go to the next slide. Here you can just see some of the coverage that has happened at the federal level and the state level. And I think this really contributes to putting pressure. As I mentioned, you know, the Biden administration really had been doing most of their corrective actions pretty quietly, but when this ex parte glitch was discovered, they really got out front of it, were public, and had sort of strong requirements and enforcement actions. And I think that really reflected some of the pressure coming in with the media coverage. And state level too. I mean, that's critical because governors are really in the driver's seat here. I mean, the Biden administration has a really important role to play, but governors are ultimately the decision makers about how Medicaid runs in their state. Next slide. So again, we've talked about this many times, but we really need targeted messages for parents and caregivers, since we do have this disparity between parents and children. And if we go to the next slide, we have some materials. They're available on our website. You know, we want everybody to stay covered here, right? So either retaining Medicaid or moving to a new coverage source like the Marketplace or CHIP. And we've developed some flyers with the American Academy of Pediatrics. There are other resources available on CMS's website. You've got to be state specific here, of course, because states have different names for their programs. They have different phone numbers, of course. So if you go to the next slide, and again, this is just kind of links for future reference. We've got a couple of different flyers here, and we can just go through to the next slide. We'll show the links for more information because I want to wrap up and make sure that I can go to your questions. But this is where you can get more information. So with that, I will wrap it up and see what questions have come up.
Thank you, Joan. That was tremendous. And thank you everyone for being with us for this presentation and being really thoughtful. I just want to note that one person commented that your data was fire, meaning that it was on fire and really on point and good stuff. I want to remind everyone to follow Joan Alker on Twitter. I dropped her Twitter in the chat. She and Georgetown have been compiling and sharing out the data virtuosically. So it's a great feed if you're interested in data. So right off the bat, we have a question. What can be the simplest way to keep a child's coverage active? Should their parent lapse out of their coverage?
Yeah, that is a great question. So, as I've said ad infinitum, that the child is probably likely to still be eligible, even if their parent has lost. And so for everybody on Medicaid, if they've lost coverage and it's a mistake, or the parent thinks it's a mistake, I mean, first of all, the parent should keep in mind the child's probably still eligible, right? And so that's a really important message, is to keep trying. But specifically, there are two pathways, essentially. One is the 90-day reconsideration period that I mentioned, where you don't have to do a whole new application. You just have to provide the information that the state said that they need. Another pathway, though, is to actually file an appeal of the eligibility determination. And in this case, family's probably going to need a legal services, somebody to help them do this, to file an appeal of the eligibility determination. And in that case, they retain their benefits while the appeal is pending. So that's an advantage of going the appeal route as opposed to the 90-day reconsideration period. But in almost all cases, for children, less so for adults, Medicaid does have 90-day retroactive coverage. And so once you get back on, if you had bills in that period where you were off, they should be paid by the state. Now, I have a blog about this. I'll try to see if I can find it, put in the chat. There are some states that have waived the 90-day retroactive period, but that's primarily for adults. So that's another kind of protection for families in Medicaid, that if they had incurred a cost while the child had a gap in coverage, and in most states, while the adult did, they can get retroactive. They should be able to get their bills paid retroactively.
Wonderful. And thank you for answering that question. And thank you for asking that question. And just as a follow-up, I think this point illustrates the fact that there are ways around this, but there is a considerable amount of administrative and procedural burden for folks. What organizations, protection or advocacy organizations, can folks look to in their areas for help when going through the appeals process?
That's a great question. So certainly legal services, I think, is the best bet. And they're very activated on these issues, both sort of systemically speaking and on an individual case-by-case basis. So I would say that's your first stop. There are a lot of organizations that work as enrollment navigators. And particularly now, as we're entering into open enrollment for the Marketplace, those navigators and assisters are another place to go for help. Absolutely. Another place I would say to go for help are the federally qualified health centers. They often have enrollment navigators and assisters. They're very focused on this issue because it's a huge percentage of their patient base is potentially losing coverage. And, again, pediatricians, reach out to trusted providers. And this is not where I normally say to go for help because I have a lot of issues with them, but the Medicaid managed care plans, in this case, they are your friend because they want you to be enrolled because they want to get paid their capitation rate. So your plan is actually another good place to try to get help if you've been disenrolled.
Perfect. Thank you so much. And we have another question in the Q&A from Rosalind. Ros asks, what role does lack of education on Medicaid on the part of state legislature and policymakers play into the loss of coverage? Would getting rid of the stigma and misinformation surrounding Medicaid recipients make a difference, especially in more conservative states? Roz, thank you for that great question.
Yeah, that's a fantastic question. So I want to mention a couple of false narratives. I touched on one of these in my presentation, but now I can really go to town on this, which is one of my favorite topics. So the first sort of false narrative I mentioned was that this bankrupted states, right? No, they got extra money. And there's data on that. But of course, that extra money is going away. So that's real. And that's going to create budget pressures on states in the next session. And that's problematic. But another false narrative is that all of these people were ineligible and we've got to kick them off, right? That there was this federal law and they made us do it. And we had to keep on all these people who were ineligible. And that's a false narrative for a couple reasons. So first of all, it always gets pinned on President Biden. I just want to note that it was President Trump who signed the law. But leaving that aside, there are many folks at all times who are eligible for Medicaid but not enrolled. And they may have turned off, in regular times. They might not have known they were eligible. And so going back to where we were prior to the pandemic is not the goal. That is not the goal because we don't have 99% participation rate in Medicaid. If you think about Medicare, we do have 99% participation. Everybody knows you're eligible when you're turned 65, excuse me, or have certain disabling conditions. And people find their way to Medicare. It's not complicated. Go to medicare.gov. 99% participation rate. Not true in Medicaid because it differs by state. There are different rules. There are some consistent rules, but states put up more or fewer barriers depending on the state. And so we have always have folks, particularly children, who are eligible. In fact, the majority of uninsured children are eligible for Medicaid or CHIP, but they're not enrolled at that time. So the goal should not be to get back to where states were before the pandemic. And this is where I want to, again, shout out to Oregon for using this time to really reconceptualize and rethink their system so that they can get to a better place than where we were before the pandemic. But the goal should be retaining all eligible people. And then for people who are ineligible for whatever reason, help them find a new source of coverage. And we talked about those, either employer-sponsored insurance, marketplace, CHIP. Those will be the main sources of coverage. So that should really be the goal. And we have to push back on that rhetoric of, we have all these procedural disenrollments. Nobody cares. They're too lazy to open their mail. No, there's a lot of problems in this process, A, and B, let's all agree on the goal. We don't want to drive up the uninsured rate here. We want to make sure that eligible people retain coverage and folks who are not eligible, we help them on their way to a new coverage source.
Brilliant. Thank you. And you actually answered my last question. You said Oregon's doing a good job in communicating the unwinding process to its folks there. What other states are doing a good job, do you think, that we can look to?
Yeah, this is a question we get a lot. We wish that we had many, many answers to that. I'll say that I think Arizona has been a state, we've still seen quite a lot of losses there, but they've been doing a lot of things right. Their eligibility system functions pretty well. They've had a really strong feedback loop with the advocates to try to correct problems in real time. They have a great data dashboard so you can really get visibility into what they're doing. But then we have other states that have paused procedural disenrollments. I mentioned Hawaii, and I don't honestly know why. If it has a lot to do with the fires, I don't know, but they've paused procedural disenrollments through the end of the year. And then I would also highlight Michigan. The governor there, and that's one of the few places, and if anybody else has seen another one of these, let me know, where the governor actually issued an executive order to all agencies of government saying, this is happening, this is a big issue, and I don't want more people to become uninsured. So agency A, B, and C, you need to all work together to prevent this from happening. And that's what I think we need. This cannot stay just in the Medicaid agency, which is understaffed and overtaxed. We need that kind of high-level commitment from the elected officials to make this go right so that folks have the resources they need so they can step in and pause if things are not going right. We need that kind of high-level commitment. It really has to come from the governor.
Absolutely. Absolutely. Thank you. Thank you so much, Joan. Thank you for sharing the data, unwinding the Medicaid unwinding so we can understand it clearer. And thank you for closing out on a really clear call to action for policymakers. And thank you to everyone for joining us today. We appreciate your time. And if you have any questions, you can email us at policyimpactproject@drexel.edu, and you can follow us at impact_policy. And also don't forget to follow Joan Alker at Joan Alker1. Thank you, everyone.